Be it in cities or towns, villages or hamlets, the one thing that's absolutely critical for its people is access to healthcare. Yet, more than 60% of India's population lives without it. At HGS, we believe in building a healthy community through our CSR program. Our aim is to bring quality healthcare to those who are needy and cannot afford it. Here are some stories of hope that we witnessed along our journey to improve healthcare. India has the dubious distinction of being the tuberculosis capital of the world. The disease kills an Indian every minute and is an engine of poverty, debt, and suffering.
Bombay is a particular hotspot where we have a very large pockets of MDR-TB within this city. MDR-TB is a particular challenge as it is very difficult to treat, requires prolonged medication as well as expensive and toxic drugs, which many a time the patients are unable to afford.
To combat this urgent and deadly health threat, HGS, along with Hinduja Hospital, renowned for its treatment for TB, have commenced a TB eradication program. The program involves rapid diagnosis of multi-drug resistant TB through the state-of-the-art method.
Our lab at Hinduja Hospital is probably one of the leading labs for tuberculosis in this country, and it is a reference lab for areas of Mumbai and around it for detecting drug-resistant tuberculosis especially.
The treatment spans for 2 years, which includes regular counseling and follow-up sessions with patients to ensure that they are on medication.
The doctor writes the treatment. We're able to follow the patients, treat them adequately, follow them through all their side effects, and enable really good cures. And our cures are clearly over 84%.
When you see your patient actually recovering and then coming back for a follow-up, having completed treatment and coming back 6 months or a year follow-up and doing well in life, no greater happiness than that.
Lack of access to safe drinking water is an urgent crisis that's affecting our cities and towns.
ನೀರಿನ ಸಮಸ್ಯೆ ತುಂಬಾನೇ ಇತ್ತು. ಟ್ಯಾಂಕರಲ್ಲಿ ಓಡಿಸೋರು, ಆದರೆ ಅದು ನೀರು ಚೆನ್ನಾಗಿರೋದು ಹೇಗೋ ಗೊತ್ತಿಲ್ಲ, ಅವನ್ನೇ ನಾವು ಕುಡಿತಾ ಇದ್ವಿ. ಅಂದರೆ ಆಮೇಲೆ ತುಂಬಾ ಸಮಸ್ಯೆ ಇರೋದ್ರಿಂದ ಮಕ್ಕಳಿಗೆ ಹುಷಾರಿಲ್ದಂಗೆ ಆಗೋದು, ಕೆಮ್ಮಾಗೋದು, ಜ್ವರ ಬರೋದು ಇದೆಲ್ಲ ಆಗೋದು.
To help increase the availability of safe drinking water facilities for the water-sparse areas in Bangalore, HGS partnered with Jaldhara Foundation to bring its expertise in installation, operation, and maintenance of water purification plants.
ಇವಾಗ ಡಾಕ್ಟರ್ ನೀರು ವಾಟರಿಂದ ಮಾಡೋದ್ರಿಂದ ನಾವೇ ಹೋಗಿ ತೊಗೊಂಬರೋದ್ರಿಂದ ತುಂಬಾ ಅನುಕೂಲ ಆಗ್ತಿದೆ. ಅವರಿಗೆ ಹತ್ರ ಇರೋದ್ರಿಂದ ಸಿಂಧಸಂದ್ರದಲ್ಲಿ ಫುಲ್ ಹತ್ರ ಇದೆ. ತುಂಬ ಜನಗಳಿಗೆಲ್ಲ ಹಳ್ಳಿ ಕಡೆಯವರಿಗಾಗಲಿ ಆ ಕಡೆ ಈ ಕಡೆ ಸುತ್ತಮುತ್ತ ತುಂಬಾ ಅನುಕೂಲ ಆಗಿದೆ.
Besides supplying safe water, Jaldhara spearheads community awareness and education programs that focus on wash at Anganwadis. The messages of health and hygiene are gaining momentum in these areas. A majority of India's population lives in rural areas where the condition of medical facilities is deplorable.
The health scenario in rural setup is like people has no accessibility towards health setup set by government, so that they have to travel about 20 kilometers, 10 kilometers walking or by any vehicle they get towards setup set by government.
to ensure that quality and timely healthcare reaches the deprived corners of the Indian villages. HGS has come up with the concept of mobile clinics. The Advanced Mobile Healthcare Unit, or AMHU, serves vulnerable populations and promotes high-quality care free of cost.
तसेच माझ्या मुलीला पण सर्दी खोकला वारंवार व्हायचा. आता आम्ही जेव्हापासून हिंदुजामध्ये उपचार घेतला आहे तेव्हापासून तिला पण बरं व्हायचं. तशाच माझ्या सासू आहेत, त्यांना बीपीचा त्रास आहे. त्या दर बुधवारी जातात हिंदुजा हॉस्पिटलमध्ये आणि वेळेवरती गोळ्या औषधं घेऊन ते जरा त्यांचा पण बरा झाला आहे त्यांना पण.
We diagnose different cases and treat them at their doorstep only, and we have very different diagnostic facilities which is not even available at the sub-district hospital many times.
The unit is equipped to carry out all the fundamental health services such as diagnosis and treatment of common illnesses and provision of medicines.
या हिंदुजा हॉस्पिटलच्या सेवेमुळे आम्हाला फारसे फायदे झालेले आहेत आणि ह्या सेवेमुळे आम्हाला जी दवागोळी आहे ती आम्हाला म्हणजे वेळेवर उपलब्ध होते. त्याच्यामुळे आम्हाला बाहेर दवाखान्यात जावं लागत नाही. त्याच्यामुळे आमचा वेळ पण वाचतो आणि गाडी भाड्याचा खर्च पण वाचतो. एवढी सेवा जर आमच्या गावात आली आहे तर मी त्यांचे फार आभारी आहे.
Whether it is liberation from terminal illnesses like TB, making medical treatment available in rural areas, or provision of affordable, economically viable drinking water access to millions in need, the initiatives undertaken by HGS to improve healthcare in India have truly engendered positive results.